If you are one of the many people suffering from plantar fasciitis, you may consider surgery as an option to relieve your pain. What is plantar fasciitis? Plantar fasciitis is a condition that causes pain in the heel and bottom of the foot. The plantar fascia is a tissue band connecting the heel bone to the toes. When this tissue becomes inflamed or irritated, it can cause much pain. In some cases, surgery may be the best option to relieve your symptoms. What are treatment options for plantar fasciitis? These include rest ice anti-inflammatory medication, physical therapy, steroid injections, custom orthotics, surgical procedure. Who is a candidate for plantar fasciitis surgery? Surgery is also an option for patients with a severe case of plantar fasciitis and significant heel pain, impacting their quality of life. Plantar fascia surgery can be performed as an endoscopic plantar fasciotomy or an open plantar fascia release. However, traditional open surgery carries a higher risk of complications. What happens during plantar fasciitis release surgery? Plantar fasciitis surgery involves releasing or cutting the plantar fascia ligament to relieve foot pain and chronic heel pain. The surgeon will make an incision in the heel and then release the plantar fascia from the heel bone. In recurring heel pain, a heel spur at the heel pad may need to be removed to help relieve pain. After the surgery, you will likely need to wear a boot or cast for a few weeks. Physical therapy is also often recommended after surgery. A physical therapist will help relieve inflammation, improve foot mobility, and relieve tension at the arch. How to prepare for plantar fascia release surgery. If you and your surgeon have decided that surgery is the best option for you, there are a few things you can do to prepare. First, it is essential to continue with conservative care until the day of surgery. This means resting, icing, and stretching the foot. It would help if you also avoid activities that make your pain worse. Second, you will need someone to drive you home after the surgery. The anesthesia can make it unsafe for you to drive. Third, you should arrange for someone to help you at home for the first few days after surgery. You will likely be on crutches and need help with activities like bathing and cooking. Fourth, it would help if you stocked up on supplies like bandages, ice packs, and pain medication. Finally, you should follow your surgeon's instructions on how to prepare for surgery. This may include stopping certain medications or eating a specific diet. Recovery. Most people take 4 to 6 weeks to recover from plantar fasciitis surgery. During the first few days after surgery, you will likely need to stay off your feet and elevate your leg. You will also likely need to wear a boot or cast. After the first week, you may be able to put weight on your foot and start physical therapy, where the focus will be on strengthening and rehabilitating the foot and ankle. Thanks for watching. Please subscribe.